Hi, I'm Dr. Brian Gray.
And I'm Dr. David Gates.
I practice cosmetic restorative dentistry in Washington, D.C.
And I practice in Las Vegas, Nevada.
We were both early adopters of clear aligner therapy and both early to join the faculty of Align Technology. For years, we've been teaching both the introductory and advanced courses in clear aligner therapy.
And this has given us the opportunity, the close-up opportunity, to see some of the challenges and even the frustrations doctors have felt in implementing various clear aligner therapies. One of these challenges relates to creating space between teeth by removing minute amounts of enamel so that the teeth can more freely move into their final desired position. This technique is called interproximal reduction, or IPR.
Each of us had developed over time similar strategies that made this technique fairly straightforward and easy and predictable. We each had searched around for the best tools in the industry and were able to find ones on the market, but they weren't all assembled together in the same place. We compared our notes on what we used and how the techniques were going and refined our techniques so that they were similar and we were using the same instrumentation.
But when we taught the courses, we would find so many dentists struggling with the tools they had on hand and the strategies that they'd learned from somewhere. It was tough to see so many doctors disliking the technique entirely. I kept thinking, it's just not that difficult. Let us show you the instruments and techniques we're using and you'll start enjoying it and seeing how easy it is.
There are really only 4 ways to make room in a crowded arch. The first way would be to procline or expand the teeth, which means to move them in a buccal direction. The second way would be to distalize the teeth. That means to move them back in the arch to help create space. The third way would be to extract a tooth, and we do that in really crowded situations. And then finally, interproximal reduction, or IPR, which means removing small amounts of enamel between the teeth to help create the space. IPR is commonly used because it reduces the need to do too much expansion and also helps us allow to keep the tooth over the apical base.
Not only that, Brian, but there are some other really good reasons not to leave IPR out of the mix. IPR simplifies the case and often speeds it up. It reduces the need to move the molars, and it increases, as you've said, the stability of the case. IPR controls and improves the overjet, and it can improve the aesthetic result of any teeth. It's important when performing IPR that the amount that's created is measured very accurately. The gauge inside the kit helps the doctor determine exactly how much he's done to the 1/10 of a millimeter. The purpose of the Axis All-Inclusive IPR kit is to perform precise, targeted enamel reduction in a very, very efficient manner. It's also important that the IPR be performed in a manner that's comfortable and unobtrusive to the patient. Local anesthetic should never be necessary when performing IPR, and the kit helps us to do that. Finally, and perhaps most importantly, IPR needs to be performed in a way that leaves the anatomy of the tooth natural, curved and rounded. The tooth starts out natural looking, it should end natural looking, not with straight, unnatural cuts.
Well, the Axis All-Inclusive IPR kit is designed for doctors new to interproximal reduction as well as experienced practitioners. A novice can start by simply using the abrasive strips to break contact and reduce tooth structure, and then advance quickly to using the super thin disc to break contact, and move from there to using the Axis Ortho strips and reciprocating handpiece. I found that by using this technique, I've been able to take what normally was a half-hour procedure down to less than 8 minutes. We begin with the yellow-colored diamond strip, which has an 8-micron grit. The instructions say that we should take away 0.4 millimeters between teeth 25 and 26. We're going to remove just 0.2 today, starting with the yellow strip and then progressing to the red and then the blue strip. So we'll get started here. We take the yellow strip to begin with and carefully slide it between the open contact, working it back and forth. We can begin with the smooth part of the strip to get it between the teeth, and then use the abrasive side to reduce the tooth structure. We then go to the red strip, which is 0.1 millimeters, doing the same motion. We follow that with the blue strip, which is 0.125. We rounded that up to 0.13 millimeters. Put that between the teeth and follow that motion as well. Now we'll go back to the red strip and we'll fold it over, making it 0.1 plus 0.1 millimeters, or 0.2 total. And we'll slide that between the teeth. And this, I'm going to come in from this angle, working that along the sides. Finally, if it feels like a very tight contact, I may actually even go to doubling up the blue, which is 0.125 plus 0.125, or 0.25 total, and work that in through there, just so it passes rather tightly, but passes through. Finally, I'll go to the gauge, and I'll measure to see that I took away 0.2 millimeters of space. When the gauge passes freely between the teeth, I know that I've accomplished my goal. Finally, I'm now going to go to my Axis Quick Strip. The Axis Quick Strip has a lot of nice little features to it. One is it's got these really great little grips to hold on to, and two, it's got a semi-lunar shape. It also has abrasive material only on one side, so that you can actually safe contour a tooth. We're going to take that Quick Strip, slide it down between the teeth, and then work it back and forth to restore that contour, that nice round edge that it originally had.
Now I'd like to demonstrate the more advanced technique. In order to do any good IPR, the contacts must be broken. In order to break those contacts, we're going to use the Axis perforated disc. This is a wonderful disc because it's only 1 millimeter thick and very flexible and is on a mounted slow-speed mandrel. You must be very careful to protect the patient with a mirror, suction, a cotton roll, or your finger, and always make sure that the disc is rotating toward the inside of the mouth, never toward the cheeks or the lips. Once you've broken the contact, it's time to use the ortho strips, which is an adhesive band mounted on a bow. In order to use the abrasive ortho strip, you're going to need a reciprocating handpiece. I'll be using the 2061 produced by Cavo. It reciprocates at about 13,000 RPM. It's slid right into the mouth of the handpiece, and then the dial on the handpiece can put it in any position convenient for going interproximally. This is the fastest and most efficient way to do IPR. I start with a 25 micron grit and then move my way up to the 60 micron grit. I personally prefer to use the one-sided ortho strip because it allows me to select between which tooth I'd like to abrade, producing a more aesthetic and a beautiful result, especially when there's not symmetry between the teeth. Notice that I'm using the handpiece, moving it back and forth in a larger motion as though it were not reciprocating at all. That way I'm combining the larger motion and the smaller motion simultaneously. I use water on the handpiece so that it's washing and keeping the sawdust off of the abrasive strip. Notice also that by dialing the head, I'm able to put the ortho strip in whatever position is most convenient between the two teeth. Once I've produced the amount of interproximal space that I desire, in this case 0.2 of a millimeter, I carefully record that on a sheet so that I know how much I've done and still how much I have to go in the subsequent visits. Doctor, you have prescribed clear aligner therapy for your patients to save them time and give them the beautiful results they're looking for. So why aren't you saving yourself time? By using the Axis All-Inclusive IPR Kit, you can reduce your chair time in doing IPR from 1 to 2 hours down to less than 10 minutes per patient.